I'm Rose Caiola, and today I'm with Theodore Henderson, psychiatrist specializing in treating children and adults with anxiety, depression, bipolar disorder, you name it, he takes care of it.
Thank you, Rose, for having me on your show. It's a great honor and privilege to be here.
So in your practice, what condition do people suffer from the most?
I think what they suffer from the most is misdiagnosis. I don't get a lot of patients who come in for the first time not having seen someone before, and they come in having seen 1, 2, 3, 5 psychiatrists, have been working with a therapist and a doctor for a couple of years, and they're often diagnosed with depression or anxiety, and in fact it's actually a biological illness.
Interesting. And how do you find out? Is there a series of tests, verbal tests, physical tests?
If you do a very careful history, then you start to see patterns in what's going on for a patient. And then, of course, I'll use laboratory studies, blood work, looking for infectious causes, looking for toxins, looking for food allergies. That's a really common one in kids. And sometimes I'll use brain scans that help me to see, what's amiss in the brain.
How does food affect mood?
Food allergies can really be very disruptive. So I have some kiddos where I figure out what the food allergy is for them, get them off that, and all the disruptive behavior goes away, all the anxiety goes away, all their learning difficulties go away, what looked like ADHD goes away.
See, that's interesting because I have a daughter, a 14-year-old, who's been diagnosed with ADHD, and, I've thought about food for a while. She is a big carbohydrate kid, and I'm always trying to push that protein on her. So I do question, the fact whether or not, maybe it is the carbohydrates that are affecting her. What other signs can I look for?
I wish there was a set pattern that we could say, that goes with this food allergy and that goes with that food allergy. But even something as simple as gluten, where someone doesn't have celiac disease, that is, they're not fully allergic to gluten, but they can have inattention problems, they have irritability, they can feel sluggish, they can have GI symptoms. And just getting rid of the gluten for even, the first week you're not going to see it, but after about 2-3 weeks, you will see the difference that gluten makes in a person's life, for better or for worse.
Yeah, and they're making it so much more accessible. I might try that. You co-authored a medical breakthrough and made the list of top discoveries in 2015 in Discover magazine. Can you tell our audience a little bit about that?
This is a pair of research studies that was published in 2015. And we use SPECT scans, single photon emission computed tomography, which are functional brain scans that shows how the brain is working. And we studied them in a quantitative fashion. It's not just eyeballing them, it's actually studying them with quantitation to show that we can differentiate traumatic brain injury from post-traumatic stress disorder. Now, these two things, they're completely different. This is an injured brain. This is a reaction to a terrible event. But clinically, they look the same. And the medicines for PTSD, they're bad for you if you have a traumatic brain injury, because those neurons are sort of teetering on the edge. They could go one way or the other, and the antipsychotics do not help the picture.
How can we get the word out there? What can we do to help, share this knowledge?
But I think the more that we talk about this, the more that we'll start to move the ball.
Now, you work a lot with adults and children. How do you treat them differently?
Very much so. Children have a much more complicated situation because they're not in control of their lives. They have to deal with whatever's thrown at them. It's complicated by, as we were just talking about, food allergies, nutrition, toxins in the environment, exposure to domestic violence. 1 in 15 children witness domestic violence. Child sexual abuse. 1 in 3 girls and 1 in 7 boys are sexually abused before the age of 18. And then, of course, the impact of social media, the impact of video gaming, all of that plays into what's going on for a child. And so we have to look at all of those pieces of the puzzle. On the other hand, it's much more about the biology. And so there I can focus more on just what's going on biologically. because they're working in therapy. They have more control of their lives. And a lot of times, it's, again, what I said right off the bat, the most common thing I see is misdiagnosis. So I'm the medical director of a clinic that provides ketamine infusion therapy for treatment-resistant depression. It's a dissociative anesthetic, and at very low doses, you're still awake, given by IV infusion over like 40 to 60 minutes. It's an amazing treatment for depression. The patients that come for this treatment, they've tried other things. They've tried at least 5 antidepressants, so they don't even get in the door. They've seen psychiatrist after psychiatrist. And 1/3 of them don't have depression. They have a traumatic brain injury. And another third of them, 1/4 to 1/3 of them, actually have chronic fatigue syndrome, not depression. And then a bunch of them actually have severe anxiety, just overwhelming anxiety that nobody has ever treated.
What advice can you give me as a parent of both a 12-year-old boy and 14-year-old girl, as well as our audience?
The problem for adolescents is that they have so much more information coming at them these days. And that is, from social media, from the internet, from their phones. They're getting texts at midnight. So probably the most valuable advice I can give to parents is to stay aware and stay connected.
So I guess I'm on course, because I tell my kids that if they want a phone and I'm paying for the phone and their monthly bill, I own the phone technically. So I have the right to research the phone and see what's on it.
Yeah.
And if they don't like that deal, then they can just give the phone back. And so it is our job and responsibility to pull them back and ground them and, make them live the life that we're pretty much accustomed to. You specialize in diagnosing and treating complex cases because
Correct.
You do more than the average doctor does. Tell us a little bit more about what's involved in your practice.
I think I'll do that with an example, probably. So there's a young lady came to me a number of years ago, 15 years old, diagnosed as treatment-resistant depression. Her doctor tried several antidepressants. Nothing made her feel better. It must be depression. There must be something, complicated here. Let's send her to the psychiatrist. And so I'm interviewing her, and I have her fill out depression questionnaires. I have her fill out fatigue questionnaires, among other things. There is no evidence whatsoever that she's depressed. She wasn't anxious. She was just tired all the time. And no one had ever asked her what she feels like when she wakes up in the morning. No one ever asked her, does she take naps during the day? She took naps every day. She had dropped out of school because she could not function enough to go to school. And this was a bright young lady. So I run laboratory work on her, and her viral titers are off the charts. And her immune function is way low. Her immune system is beaten up. And I started on treatment. And she is now at university, having successfully recovered, gotten back into school, gotten straight A's in high school, went to a very nice university, has straight A's, and she wants to major in virology.
Wow.
She wants to become a virologist because viruses changed her life.
Sure. Wow. That's amazing. I mean, do you do the same then with children that would have like ADHD? So you're not just medicating them, you're really finding out what their issues are by really picking things apart and figuring out where they're at and what really is going on with their mental and physical state.
Look at the world of autism, and you look at the world of, I work with a lot of children who have mental retardation and other psychiatric issues. You can't just assume that it's, what it appears to be on the surface.
We figure that we should just pay attention to the diagnosis, of the doctors that are treating us. It's like the doctor that says you have a terminal cancer and, 2 months or 2 years to live, when it's not really necessarily that way. I mean, you're opening a whole new door. And I know autism is also big on the spectrum now. At first with Jenny McCartney and her son and all that with the immunizations. What do you have to say about that? What's your feeling? Is it the same? Would you go back to diet?
diagnoses in psychiatry and in a lot of medicine are made up. They're artifact. What is ADHD? It means you're inattentive, hyperactive, and impulsive, but I've already given you a whole bunch of things that can look exactly the same. And actually, if you scan someone who has ADHD, you can get 5, 6, 7 different kinds of brain scan patterns. It's not the same thing. It's not one thing. Autism is even more that way. Saying autism is sort of like saying cancer. Well, cancer what? What grade of cancer? What's the lymph node involvement? So in autism, there are so many different things that lead to this final common pathway of autistic behaviors. This is why I get called a biological psychiatrist, is because it's really important to look at what are the biological underpinnings of the behavior. Because if you just say, oh, well, this is autism, let's treat it as, all psychiatry says to do, what are we doing? We're saying, okay, we're going to put you on an antipsychotic. Because that's what's FDA approved for autism. Well,
and
actually,
that's the
no.
protocol, right? That's the protocol. There's also protocol that goes with that, right?
Right. Mm-hmm.
Now, you also talk about reversing the brain, reversing the damaged brain by a laser.
So infrared light, in particular wavelengths, will activate the mitochondria, which are the little energy manufacturing things inside of our cells. And our neurons, our brain cells, are packed with mitochondria. And when you activate the mitochondria, you turn on growth factors, you turn on all sorts of healing processes, and you activate over 100 genes in the DNA just by literally shining a light on the neurons. It produces a beam of light, which you can't see, but it's a beam of light. And with that beam of light, we know the power of the beam of light that we're delivering to the scalp. And based on our laboratory studies, we know how far it gets into the brain. So if we know where we're trying to fix, in other words, we have a brain scan, a SPECT scan that shows us where the injury is, then we can target precisely to that area of injury. And the result is amazing. I mean, I don't even believe my own results sometimes. We have patients who within 10 treatments, they no longer are having sleep disturbance, they don't have headaches, they can think clearly again, they're not irritable, their depression symptoms go away. All the things that we see in traumatic brain injury are getting better within 10 or 20 treats.
You're coming out with a new book.
Yes.
Right? It's due out the end of this year, hopefully early next year.
We'll see.
Okay. And it's about going viral for mental health. What are you hoping that people will get out of the book?
Psychiatric symptoms are not necessarily just in your head. It's not just because you're lazy or because you're, unmotivated. These are infectious agents, viruses, parasites, bacteria that can literally change your behavior.
I talk to so many friends that, they'll be diagnosed with something and then they're going from doctor to doctor to doctor because they can't find out what's wrong, or this doctor's recommending, this medication, then they do that and then they go someplace else for another medication. And it's just, and their instinct is telling them that it's probably something so simple, but they just can't find the proper treatment. So, do the homework, do the research. And where can they find you?
I'm an old-fashioned guy. Call me on the phone, 720-493-1101. And I'll tell you what, Rose, it's such a pleasure and a privilege to be on this show, and I am so passionate about what I'm working on. Anybody who calls me and mentions the show, I'll give them $100 off a comprehensive evaluation. Because I want patients to get better. I want this shift to occur. I want chronic fatigue syndrome and fibromyalgia and depression to be recognized for what they are, biological illnesses.